As millions of Sydneysiders steel themselves for a further 2 weeks of lockdown, Victoria is scrambling to contain a COVID outbreak that's leaked across the border. Multiple exposure sites have been added in Victoria overnight after 11 people tested positive yesterday in a rapidly growing outbreak seeded from red zones in Sydney. Victorians have again woken up to new mandatory indoor mask rules reintroduced at midnight last night.
Further north, there is no relief in sight for Sydney, with the current outbreak's second worst daily case numbers recorded yesterday. The virus has now spread to a staff member at Westmead Hospital, while several staff at Liverpool Hospital are in isolation this morning after being exposed to a COVID-positive patient. It is a fast-moving story this morning. Let's go straight to our reporters, Lara Himes in Sydney, Zali Rismal in Melbourne. Zali, good morning. Starting with you, tell us about the new restrictions introduced last night.
Good morning, Michael. Well, Victorians may not realise yet, but late last night, the Health Department issued an alert that masks are back in all indoor settings from midnight last night. Of course, it's just several days ago when they were taken off for workplaces and schools as well, but they are back mandatory in all of those indoor settings, and also when you can't socially distance outdoors for anyone aged over 12. But of course, the big question is, what other restrictions are coming, if any, and are we going back into lockdown? Now, at this stage, there are no other new measures that have been introduced so far, but we do know that the public health teams were reviewing the situation yesterday, and senior government ministers were meeting with health officials last night to review the situation and see if anything needs to be done. We do know that they'll be taking a fast and aggressive approach to contain this outbreak, but a nervous wait really awaits Victorians this morning.
What do we know about the latest cases in Melbourne?
Well, 11 cases confirmed in the last 24 hours in Melbourne. Now, there's really two chains of transmission there, two clusters, both linked to New South Wales. Now, among those 11 is a man in his 30s, linked to that family of four who recently returned from Sydney before testing positive. Now, despite being on red zone permits, at least one of those family members has left isolation and gone to the Craigieburn Coles on the weekend, and it's there that authorities believe this man has picked up the virus. In addition to that, there's at least 9 cases now linked to those Sydney removalists who worked inside an apartment complex in Melbourne's northwest. Now, among those 9 are 4 residents across 2 households. They include a man in his 60s who lives alone, but unfortunately he's passed it on to his elderly parents aged 89 and 90, and also to a friend who he's met to go to the footy with. So I must stress that this man has done nothing wrong. He's been unknowingly exposed to the virus, but his movements have led to the identification of several quite concerning exposure sites. Now, they include a pub in Melbourne CBD opposite Flinders Street Station, and also here the MCG for the Carlton-Geelong game on Saturday afternoon. But we've also got then a teacher at the Bacchus Marsh Grammar School. Now, that is this man's friend. The ABC understands this person has also infected 2 of their family members, and Barwon Heads Primary School is also closed today because of a confirmed case there as well. So a rapidly changing situation. We've already got more than 70 exposure sites going up overnight. They include a High Point shopping centre. We've got regional ones now as well due to that Barwon Heads case, the netball and football club there. Tram and train services in Melbourne, a DFO in Melbourne's north, and also in the southeast we've got a very popular patisserie out in Oakley. So really important that people check on those exposure sites and ensure that they haven't been to any, and if they have, to take action.
Zali, thank you. Lara Himes in Sydney. So the lockdown there has been extended. People there coming to grips with that?
Well, the extension, Michael, will go for at least another 2 weeks. We'll start to see, or continue to see, these quiet Sydney CBD streets as well as the greater area of Sydney. Now, this is in response to the 97 cases that were recorded yesterday. Of that, there are 61 cases which are linked, 36 which are still under investigation, but the figure which has health authorities most concerned is the number of cases that were out there in the community for the entirety of their infectious period. So that stands at 20. 24. The reason why that is concerning is because that is going to determine government policy going forward and also how the virus is propagated throughout the community. There's been several exposure sites that have been added all across Sydney, but there have been 2 hospitals which have been added to that list. This is because a worker at Westmead Hospital, a nurse, tested positive after working in the COVID ward. We understand that nurse was fully vaccinated and in PPE at the time, but we understand that there is no cases of transmission linked to that individual. The second hospital which is on high alert is at Liverpool Hospital. We understand that a patient had tested positive to COVID, and as a result there have been several close contacts which have been identified. In response to that, we understand that the elective surgery at that particular venue has been postponed. Non-urgent surgery will now be rescheduled. So that is continuing to be a situation for health authorities which has them concerned. Obviously, with the Fairfield edict, that is a requirement that workers who are essential, who live in the Fairfield area, are required to get tested every 3 days. That is still continuing, and in response to that, we know that the government have ramped up its testing capabilities. There are now 3 testing centres around that particular area which are open 24/7, and additional times have been added to existing testing facilities around that particular area too. A total of about 400 testing sites are throughout New South Wales.
Lara Harms, Ali Rismal, thank you both for the updates. Meanwhile, Queensland authorities have issued a new public health alert this morning involving an international traveller. The state's health department says it's been notified by another country that a positive COVID case diagnosed overseas was in the community last Friday prior to departure. Potential casual exposure sites have been identified at North Ipswich, Inala and the Brisbane airport.
South Australian authorities have warned they're actively considering restrictions with growing concern around COVID outbreaks in New South Wales and Victoria. It comes as a third exposure location linked to 2 COVID positive removalists was confirmed last night by SA Health. Meanwhile, rules for Victorians entering the state have been tightened with mandatory tests now in place.
Western Australia has snapped its borders shut to Victoria once again as those COVID concerns mount. Arrivals from Victoria will now be forced into isolation for 14 days. Travellers must also present for a COVID test on arrival and on day 11.
The federal government says parents in Greater Sydney who keep their kids home during the COVID-19 lockdown will not be charged childcare fees by their providers. From Monday, rule changes will come into effect, which will see many childcare centres affected by the lockdown waive gap fees for children who don't attend. The government says more than 200,000 families could benefit.
Let's take it to Fairfield in southwestern Sydney now, where there's been high demand for testing as new COVID rules were introduced. Reporter Alison Zhao joins us now from the 24-hour testing clinic in Fairfield. Alison, good morning to you. So there is now, thankfully, some extra testing capacity in Fairfield.
That's right, Michael. There is still a substantial queue of cars here at the Fairfield Showgrounds testing clinic, but it's really nothing compared to what we saw yesterday, where kilometres upon kilometres of cars were spilling out onto the streets of Fairfield. And yesterday, the New South Wales government told workers who had to get tested every 3 days to go and get tested closer to their workplace to ease congestion and pressure on the Fairfield area. But they've also significantly ramped up their testing capability. So this testing clinic has now been turned into a 24-hour testing clinic beginning from today. And from 10 a.m. this morning, a new testing clinic, which will also be 24 hours, is being set up at Mount Pritchard at the Mounties Club car park. So that means there will be now 3 24-hour testing clinics servicing this Fairfield community around the clock, and that will significantly ease pressure here, where it is a hotspot area where health authorities are most concerned about.
And Alison, a Westmead Hospital staff member has also tested positive to COVID.
New South Wales Health has confirmed that a staff member at Westmead Hospital tested positive to COVID-19, and we know that that was a nurse who worked in the COVID ward, and we know that they were wearing full personal protective equipment. The department says that the nurse's infection was detected during a routine screening, but no further transmissions have been found. But we also know that several staff members at Liverpool Hospital, also in Sydney's southwest, are now in isolation because a patient there tested positive to COVID-19, and that patient was a woman who was pregnant, and that has meant that the operating theatres have had to be closed and deep cleaned, and that's meant that non-urgent surgeries were postponed and now being rescheduled. So several staff members there who were close contacts are now in that 14-day isolation, and they're still contact tracing for that female patient.
Alison Zhao, thank you very much for the update. A petrol station north of Albury on the New South Wales-Victorian border has been identified as a new venue of concern after two removalists visited last week on their way to Melbourne and South Australia. Reporter Michaela Ortolin joins us now from Gindera. Michaela, good morning. What do we know?
Good morning, Michael. We know that these removalists that have come from Sydney's west into Victoria and then South Australia did make a number of stops in regional New South Wales along the way. So overnight, the New South Wales Health Department has updated its list of exposure sites to include a number of these locations. So they include Gundagai, Coles on Mount Street and Middle Street on Thursday, the 8th of July between 1 a.m. and 1:30 a.m. Gindera Shell on Uranus Street, which is where I am currently at the moment, on Saturday the 10th of July between 11:15 and 11:45 a.m. Now, the advice is if you visited one of these locations or any of these locations, you must get a test and isolate for 14 days regardless of returning a negative result. Now, there's also been a third exposure site added to that list. That's the Shell Hay Roadhouse on Moama Street in Hay on Saturday the 10th of July between 7:30 and 8 o'clock a.m. Now, the advice for this location, if you visited there, you must get a test and isolate until returning a negative result. However, if you visited the location within the last 4 days, you must also get another test on day 5 from the date that you visited that location and isolate until returning a negative result as well. Now, it is an area of concern. Obviously, we've got on the date that this exposure site was visited, there was a local football match here in Gindera versus Childcare. So we're expecting that there is an increased amount of people that have visited the area and potentially be exposed to this site. So there are a number of clinics for testing that are set up right across the region. And we understand that there will also be a pop-up clinic established in Gindera as well, just to help with those expected high demand of testing that we should be seeing. So the advice in the community is that we know New South Wales Health will be making calls to people who have used the QR coding and have checked in at these locations, but don't wait to get a call from the New South Wales Health Department. If you know you visited any of these sites or if you do have any symptoms at all, get tested immediately.
Gee, my heart goes out to the community, Michaela. People there must be on tenterhooks.
Yeah, they definitely are. It's something that we've managed to avoid. Basically, the entire pandemic is cases around the region. We've only had 1 or 2 here or there, but obviously we know how contagious this variant of COVID is. It's that Delta variant. So the fact that these removalists were in these locations over the weekend and we're only just finding out about it now is definitely a reason to be slightly concerned. Now, we did speak to the member for Albury, Justin Clancy, overnight, and he said that reason that it's taken so long in identifying these exposure sites is basically because of the removalists not being quite open or honest about the places that they visited. We understand that New South Wales Health had to take measures, extra measures in finding out these locations, including using CCTV footage as well as checking the last time or the locations that they've used their credit cards. So it is slightly concerning to know that. And also another area of concern, obviously, is those borders. We know that there's soft border closures in place at the moment. We know that there's growing cases in Victoria and obviously still a high number of cases in New South Wales. So we understand that the Victorian government has been quite open and honest about the potential of closing those borders and making changes if required. So it's something that looms over the entire community's head at the moment is whether or not there will be changes made to the border or additional restrictions put in place. So I guess we just have to sit tight. Yeah. We hope that everyone can go and get tested and do the right thing, and we'll wait and see how the day pans out.
Yeah, a bit of anxiety about. Really appreciate the update, Michaela Orton. Thank you so much.